Phlebotomy Certification Practice Test. Question 1. Which of the following conditions would be most likely to cause hemoconcentration? Hypoglycemia, leukemia, proteinuria, dehydration. Dehydration reduces plasma volume, increasing the concentration of cells, proteins, and other analytes. Prolonged tourniquet application can also cause localized hemoconcentration, which falsely elevates hemoglobin, hematocrit, and electrolyte levels, affecting test accuracy. Question 2. Swelling caused from blood leaking from a blood vessel is A. Edema, sclerosing, thrombosis, hematoma. A hematoma is a localized collection of blood outside blood vessels, caused by leakage through a damaged vessel wall. In venipuncture, hematomas typically result from incomplete needle insertion, needle withdrawal while tourniquet is still applied, or inadequate pressure after needle removal. Question 3. A phlebotomist most likely would not use a butterfly for which of the following patients? An elderly patient with thin skin, a wiggling child, a patient with resilient and bouncy veins, a patient with small thin veins. Butterfly needles are designed for difficult veins such as small, fragile, or rolling veins in elderly, pediatric, and oncology patients. Patients with resilient, bouncy veins can be easily accessed with a standard straight needle, making butterfly use unnecessary. Question 4. What information would not be indicated on the label of a blood bank specimen? Patient's date of birth, NPO status and time of last meal, date and time of specimen collection, patient's full name including middle initial. Blood bank specimens require patient's full name, date of birth, medical record number, collection date, time, and phlebotomist's initials. NPO, nothing by mouth, status relates to fasting requirements for chemistry tests, not blood bank specimens for transfusion. Question 5. By bracing the hand while holding the needle assembly against the patient's arm, you decrease patient discomfort, prevent excessive needle movement, decrease possibility of hemolysis, allow tubes to be filled quicker. Bracing the hand against the patient's arm stabilizes the needle assembly, preventing excess needle movement during tube changes. This technique reduces the risk of vein trauma, hematoma formation, and patient discomfort while maintaining proper needle position within the vein lumen. Question 6. What antiseptic should the phlebotomy technician use to collect a blood culture? Peroxide, witch hazel, isopropyl alcohol, chlorhexidine gluconate. Chlorhexidine gluconate is preferred for blood culture collection because it provides superior antisepsis with residual antimicrobial activity. It is more effective than alcohol alone at reducing skin flora that could contaminate the culture and cause false positive results. Question 7. When a patient states that he or she has a needle phobia, the phlebotomist should have the patient lie down during the procedure, let the patient chew on candy or gum, show the patient how small the needle is, let the patient handle the equipment prior to the procedure. Patients with needle phobia or history of fainting should be positioned lying down, supine, during venipuncture to prevent injury from falling and promote blood flow to the brain. The procedure should be performed quickly and calmly with the patient's head turned away from the puncture site. Question 8. Which of the following would be first in the sequence of performing a finger stick procedure? Sanitize hands and put on gloves. Clean and air dry the puncture site. Select the puncture/incision site. Warm the puncture/incision site. Hand hygiene and gloving are the first steps in any blood collection procedure to protect both patient and phlebotomist from cross-contamination. After donning gloves, the phlebotomist selects and warms the puncture site, then cleans and air dries the area before performing the puncture. Question 9. The phlebotomist has prepared the patient's arm and found the basilic vein. Has the phlebotomist selected the preferred vein site for venipuncture? No, the median cubital vein is preferred. No, the femoral vein is preferred. No, the cephalic vein is preferred. No, the radial vein is preferred. The median cubital vein is the preferred venipuncture site because it is large, well anchored, and located away from major nerves and arteries. The basilic vein is a secondary choice as it lies close to the brachial artery and median nerve, increasing injury risk. Question 10. A basal state specimen used to establish reference ranges for inpatients is best collected anytime because patient is confined to the hospital. Early in the morning after fasting for 12 hours. In the morning immediately following breakfast. Anytime a patient is fasting. A basal state specimen is collected early in the morning after a 12-hour fast and abstinence from strenuous exercise. This represents the body's metabolic baseline, unaffected by recent food intake or physical activity, ensuring accurate measurement of glucose, cholesterol, and triglycerides. Question 11. Which of the following tubes is normally used to collect a serum sample? Green top, purple top, red top, blue top. Red top tubes contain no anticoagulant or a clot activator, allowing blood to clot naturally. After centrifugation, the liquid portion is serum, used for chemistry tests including electrolytes, liver enzymes, and cardiac markers. Serum is preferred for tests where clotting factors would interfere. Question 12. What is the correct procedure to stop the bleeding at a venipuncture site? Apply an alcohol prep pad and firm pressure. Have the patient bend their arm and hold it there for 15 minutes. Place a gauze pad over the site and hold pressure for 5 to 15 minutes. Apply a cotton ball to the site and hold. A clean sterile gauze pad should be placed over the site and held with firm pressure for 3 to 5 minutes, longer for patients on anticoagulants. Gauze is preferred over cotton balls because cotton fibers may adhere to the puncture site. Alcohol pads should never be used as they cause stinging and interfere with clotting. Question 13. The main reason not to use expired evacuated tubes for blood specimen collection is: they may exhibit incomplete filling. Manufacturer will not ensure they are still sterile. They will crack during centrifugation. The barcode on the label will not read properly. Expired tubes may not fill completely because the vacuum gradually diminishes over time. Partial filling alters the blood-to-additive ratio, causing inaccurate test results. Additionally, additive effectiveness may degrade, and tube integrity may be compromised, affecting specimen quality. Question 14. Which of the following best describes the proper collection of a sputum specimen? Saliva is spit out into a sterile cup. Mouth is rinsed with water followed by spitting into a sterile cup. Coughing into a microbiology culture plate. Mucus is coughed up from deep in the lung into a sterile cup. Sputum specimens must come from the lower respiratory tract, not saliva or postnasal drip. The patient should deep cough to produce mucus from the lungs, collected in a sterile cup, preferably early morning when secretions are most concentrated for accurate culture results. Question 15. What is the primary reason that additive tubes should be gently inverted and not vigorously mixed? To save the phlebotomist time and energy. To avoid hemolyzing the blood specimen. To avoid breaking the collection tube. To avoid leakage of blood from the collection tube. Gently inverting tubes 5 to 10 times ensures proper mixing of blood with additives without damaging red blood cells. Vigorous shaking creates mechanical shear forces that rupture red blood cell membranes, causing hemolysis, which leads to inaccurate test results and specimen rejection. Question 16. What type of specimen is requested for an ova and parasite analysis? CSF, cerebral spinal fluid, fecal, synovial fluid, amniotic fluid. Ova and parasite analysis requires a stool, fecal, specimen to detect intestinal parasitic infections. The specimen is examined microscopically for parasite eggs, ova, cysts, and adult worms. Multiple specimens may be needed because parasites are shed intermittently. Question 17. A specimen that requires chilling for transportation to the lab should be placed in an ice chest with cubes of ice, a container with frozen ice packs, a container immersed in a slurry of crushed ice and water, an ice chest with crushed ice. Specimens requiring chilling should be placed in a slurry of crushed ice and water, which provides consistent temperature, 0 to 4 degrees Celsius, without freezing. Direct contact with frozen ice packs can freeze the specimen, causing cell lysis and analyte degradation. Question 18. With adequate fluid intake, the average adult daily urine output is how many milliliters per 24 hours? 460 milliliters, 720 milliliters, 1000 milliliters, 1250 milliliters. Normal adult urine output ranges from 800 to 2000 milliliters per 24 hours, with approximately 1250 milliliters being the average for a well-hydrated adult. Output below 400 milliliters indicates oliguria, above 2500 milliliters indicates polyuria, suggesting possible kidney dysfunction or metabolic disorders. Question 19. The addition of which preservative allows urine to be stored at room temperature while still providing results comparable to refrigerated urine? Toluene, formaldehyde, acetic acid, boric acid. Boric acid inhibits bacterial growth while preserving cellular elements and chemical analytes at room temperature for up to 24 to 48 hours. It is particularly useful for specimens that cannot be transported to the lab immediately or refrigerated. Question 20. What is the term used to describe a portion of a specimen used for testing, usually prepared by transferring some of the specimen into other tubes with the same identification information? Aliquot, aerosol, analyte, allotment. An aliquot is a representative portion of a specimen transferred to a separate container for testing while maintaining the original specimen's integrity. Each aliquot must be labeled with the same patient identification information to ensure traceability and reduce contamination risk.